based in Cox's Bazar. We are a network of 130 Bangladeshi and international NGOs who are currently working in the Rohingya response in Cox's Bazar, both in the camps serving the needs of Rohingya refugees, as well as in the host communities in the district of Cox's Bazar. The key areas in which we are currently coordination, because as you can see, in a complex humanitarian response such as the one in Bangladesh currently, the number of coordination is huge. So therefore, we are serving that need of information sharing and coordination to make sure that our partners updated and accurate information in an ever evolving context. Uh, we also represent NGOs in key humanitarian fora and coordination mechanisms, and also with donors and other stakeholders, making sure that NGO voices and NGO considerations and concerns are accurately represented. We also work on key issues that are currently concerning the communities, the affected communities that we work with. And we work also towards building partnerships and strengthening capacities of the NGO members that we have. So that is it for now. I will have an opportunity to talk more about.
Thanks so much, Ipshita, and raising the important point again of the different types of hazards and mass displacement, and not forgetting that, and the different roles CSOs can play. Last but not least, we have Mihir Joshi with us, who is the Chief Convener of SEEDS India. Over to you, Mihir.
Yeah, thanks, Kea, and good afternoon, all the participants. So myself is Mihir. I work with a national NGO within India called SEEDS. So SEEDS is an abbreviation. It stands for Sustainable Environment and Ecological Development Society. We have been working in the humanitarian sector from past 25 years. We celebrated our 25th year last year. And like one of the key area where we are focusing is that how we can build the resilience of the community through innovations. Being a group of people coming from technical as well as social background, we firmly believe that the way to go forward, being a multi-hazard or a specific problem, is to empower the affected communities or threatened communities. And we are seeing a more risk due to contribution of the climate change. In fact, currently I am receiving lots of message for the upcoming cyclone, which is about to hit today on the eastern part of India. So in the time of COVID, we are also seeing this various impacts of climate change. So I would be happy to kind of share our experiences. And we have also thought about what should be the strategy for the next 10 years. We have contributed towards various policy aspects within India as well as at the regional level, as we are also one of the founding member of ADRN. So we are seeing more and more threats due to climate change, and we firmly believe for the next 10 years, we need to work around it to ensure that we empower the vulnerable communities across countries and share our experiences with our partners within the region as well as at the global level. So really looking forward to share our experiences as part of this webinar. Um, so I will stop here, right? Yeah, over to you.
Thanks so much, Mihir, and for raising that really important point of one of the objectives of the webinar, talking about strategies moving forward and having that vision and, the compounding nature. So everyone can see from the panelists we have today, we've got this wealth of knowledge and experience for the discussion. Before we get into the questions, we actually have poll questions for the participants as well. So I think they will appear now on your screen. I don't know if we'll be able to start with the first question, if we can, and this will help us kind of link it back into some of the discussion. Great. So if everyone can feel that first question now. Can everyone see it?
Yes.
Great.
People are still filling it up.
And I guess maybe to think of it as, are you living in a multiple hazard area, as a yes, no question.
Hi, if enough explanation, the question might get confusing for everybody. Sorry for that. So you can choose yes if you are living in a multiple hazard area, or no if you are living in a single hazard area. Thank you.
Thanks to you. Yeah, exactly. We'll give it maybe a few more seconds and then we can see the results of the poll.
Like yeah, so 58% of participants already voted, and current current position is 82% participant answer it yes, and 18% participant answer no.
Right. Yeah. So showing the really relevance of this topic and the different, all the environments, despite where we are across the region, that we're facing this commonality in issue. Thanks for that, Rizky. And there'll be time, I guess, people to continue to answer more poll questions as we go through. So let's get straight stuck into the discussion now. My first question will be for May 4th. You know, we hear a lot about the role that communities have played in response, but I think there's, you know, this equal question to you about what role you see for communities in implementing multi-hazard, you know, mitigation and preparedness programs, and you know, what are the lessons you think we're learning and recommendations for NGOs and CSOs supporting this work of communities. So thanks, and over to you, Mayflower.
Yeah, thank you very much for that wonderful question. Very multi-hazard question as well. Okay, yeah, thank you. I think the role of the community for multi-hazard issues and concerns are very crucial, and still is with the context of community-based disaster risk reduction management. Their role still should they should all continue to do their role in assessment. They should be part of the assessment of the of the situation, whether it's COVID or COVID by plus typhoon, or typhoon plus COVID, or earthquake and COVID, things like that. So they should be part of the assessment because they're still on the ground. They know what happens. They know what usually happens when there is a disaster. And after the assessment, they should give also recommendation and inputs on the planning, and they should also be part of the action, real action on the ground, for response, for the different actions that is triggered by the planning, whether it's preparedness, prevention, mitigation, and then also response and even recovery. And of course, the community, their role, there is also a very crucial role in monitoring and feedbacking the programs that the different actors are doing, like for if it's from the government or if it's from the CSOs. They should have the role of giving the right feedback to have a more accountable actions from the humanitarian actors, no. Right now in the Philippines, when we say lessons learned, when COVID came, I think a lot were flat-footed when it came, because not all or most do not have a plan uh for a pandemic. And well, a lot of people are very used to flooding, typhoon, and but when it comes to COVID, well, a lot was a bit shocked, because we had a lockdown here in the Philippines. We have a lockdown, so all the experiences that no food, limited mobility, a lot of restrictions in a lot of things. And so, which gives more weight on the role of the community, because if they would know what to do, then lesser and lesser actions would be needed at the national level or even at the local government level. If they will be empowered on the things that they should do, they will be given food at the local area. If they will be given like resources to have their own food, then that would be better. During the past time, especially when we started March with our different quarantines and lockdown, the people in community have real challenges, and but some of the community people were able to have good lessons in helping each other. What they did was, like for example, they have this community cleanup. Each household would clean their houses and outside to disinfect or prevent viruses to go to their houses. And then so it's a community effort, community initiative, and it helps. That's only one. Another is like they have this community grocery, wherein the people in the community would like, because you have very limited uh limited mobility in going to the market and things like that. So the community decided, okay, if you will go to the market, then they would share, give some money, and then let that person or some other person be assigned to go to the market. And then other neighbors will ask also to buy something, and then it will be, so when they go back, you will use less resources. At the same time, they can share what they have bought in the market. Now, after a time, then another person will be in charge for this. So that's community grocery, community market altogether. So that's one. Second one. And then the sharing of local produce, like especially in the rural areas, wherein if for example you have like garden, in-house garden, or in your backyard you have a garden, then you can share. If I will give you some squash, the other would give them other vegetables, no. So those are local things that helps a lot of the people in the community, and it also comes with the culture of sharing, but at the same time also helping each other to have limited going out of the community, instead of going to the market and things like that. Then they would have to share the resources that they have. So the more local the actions are, and the more shared it is, as long as you don't share the COVID, then it will be good. So that's one good practice. So you start with what the local people have, and then you empower and strengthen the mechanisms that they have for it. So that's only COVID. Now we had this typhoon. We had say you remember, if everybody can hear in the news, we have like three typhoons in a row lining up, and hit us really very very bad. And the existing problem that we already have for lack of evacuation center even without COVID worsened, because now you have COVID, so you have should have extra space for extra physical distancing and all those. But again, the people would have to adapt on whatever resources that they have. So where we have standards and we should follow standards, but of course in reality you have to adapt on whatever resources that you have. So if you have like an evacuation center like a basketball court, and that's the only resource you can share with, then you would have some mechanism to make sure that they would have spaces so that they would not contract the virus and things like that, or you would have mechanisms wherein you would separate those who have symptoms or not and things like that. So these practices that are being done by the local people in the community is a big check if the community has more roles in doing solutions. No, I think so. The roles in the communities should, if you ask me what are their roles, well, they should be following the community-based disaster risk reduction management approach, meaning the people in the community should have a real role in every step of the way: assessment, planning, monitoring, and evaluation. So, and the question, the last question that Kay was asking was, um, what do CSOs and NGOs can do in order to support these roles? In our experience in CDP, being a member of so many networks in disaster risk reduction, one is Disaster Risk Reduction Network, which sits also in the national level for policies in disaster risk reduction, and also we also sit in the National Anti-Poverty Commission, victims of disaster and calamities, as one of the member of the sector. We help in we have I think we have uh, for this, what do CSO do? I think I have an ABC. A, number one, A is advocacy. So DRRnet, NAPSI VDC, CDP helps in advocating for more community participation, more community involvement, more community feedbacking. NAPSI VDC, one of our organization where we are involved with, we have a massive survey of the comments of the people in the community on the feedback of the programs that we have for COVID. So it helps a lot for the government, and the government also gave us a blessing in doing that feedback mechanism in order to improve the program. So one is advocacy, continuous advocacy, and of course, as I've said, continuous advocacy that the people in the community should have a representative in local government or even in the national government, for CSOs and people's organization to sit in those policy making bodies so that we will have a better mechanism in doing things. So that's A, advocacy. Another one is adapting. So while we do those things at the national level, and it is really very challenging role, no, role in really advocating and making sure that the voices on the ground will be heard, trying to connect the national with the local level, trying to connect them, whatever challenge there is, we still have to do that. So another is to adapt. So what we do when we adapt, we still do actions at the local level. What do we do when we adapt? We coordinate with the local government, and it's much easier, when you do local, it's much easier. Not really bounded with so many bureaucratic things, but at least face to face, the local government usually is very much thankful and welcoming in partnering with CSOs. So, in to support local initiative and community initiative, you should do local and adapt locally. So that's letter A, no? Advocacy and adapting. And B, I put bayanihan. Bayanihan is a local term in the Philippines, which means it's a culture of helping each other, a culture of helping each other. I think it, especially now that you have multi hazards, you have big typhoon and then you have COVID, then you we should continue the culture of helping each other in the community. So sometimes, no, if some families do not receive any help for food or for shelter or for whatever, then if you continue the spirit of bayanihan or helping each other, then they can still live because their neighbors were able to help them. Especially now in the new normal, when you have typhoon, as I've said, evacuation centers are not enough. Never enough when there's no COVID, but now that there's COVID, then it's much the spaces are much more needed. So the more that you should involve community people, like some rich people in the community, to get involved and to help out other people. And of course, the relatives of others, the relatives of the most vulnerable, usually accommodate families that were hit and by the typhoon and flood, so that they need not go to the evacuation center, wherein a lot of people are cramped up, and to avert COVID contamination. And at the same time, uh, they will be more taken care of. Again, that's part also of bayanihan or the culture thing, no? So as CSOs, we should continue to support those mechanisms and culture. So B. Then C. C is for coordination, endless coordination and connecting. As I've said, CDP is very fond of connecting a lot of people, connecting help, connecting organizations like us. We have so many partners. I believe some of them are here now with DAPC, BDC, National Anti-Poverty Commission, Victims of Disaster and Calamities. That's the what the acronym stands for. We're in that National Anti-Poverty Commission has 14 basic sector for children, women, victims of disasters and calamities. There are different sectors throughout the Philippines, and these sectors are those who are usually hit by disasters. And so, the more we connect them to the right agencies or right CSOs or right NGOs that has help, then the better they can move forward. Because as we've learned, no man is an island. Well, I can say that no organization is an island, especially for multi-hazard. You really need a lot of help with different expertise and different resources. And so, so yeah, you coordinate with your partners. Also, for like what we have in DRR net, we coordinate for advocacies, and always bringing connecting the local to the national, and also sharing it with the international, just like this. I would like to share, permit me just a bit more.
A
I
quick
would
yes,
like
just
to
a
I would like to share one example of what we did for our local action. One big problem this multi-hazard pandemic, we have COVID and then the typhoon, is the psychosocial support. What we had is we were funded by local organization, church organization in the community, and then we connected some local experts to bring on the psychosocial support for frontliners, for community people, for persons with disabilities, and at the same time connect with the local government. And not using much resources, but just connecting their specialties and a bit of resources, we were able to help a lot of frontliners and community people and community actors and humanitarian responders to have at least a release in this kind of situation. So still a lot to say, but I will stop from there. Kea, I hope it helped.
Absolutely. Thank you so much, Mayforth. I think you highlighted, like you said, we know that people are going, communities are such an important part of the solution, but if they're not part of the planning, the assessment, every other process beforehand, they can't be part of that solution. We've got to be able to support it and using platforms. So I think, yeah. I'm going to just, and we're looking at the interest of time, to the other panelists, I don't know if there's anything, Mayforth gives a really comprehensive coverage. So unless there's something you think, I say burning, that you have to add, I think we can either add it to when you're responding to your questions as well. So we might do it that way. So then we can at the end come back to that in the discussion time, if that's okay. Great. Okay. So before we move to our second panelist, we will have another poll question, and this links to our next discussion, which is, if it could come up, it's, are you confident enough? The next poll question.
It's okay.
Okay. Thanks, Mayforth. So if, yeah, this next question, if people could take the time now to. Yeah, that's an interesting, where, a lot of us are saying we're exposed and we live in these multi-hazard environments, but we don't necessarily feel that we have the capacity and the resources and tools to be able to do our work and respond effectively. So this leads us nicely into our next question and discussion with Margarita about, sorry, I guess from what you're seeing in your perspective, what capacity support do you think CSOs and NGOs need to respond to multi-hazards? And then who do you think, and from whom should that capacity support come from? So keeping in my theme of multi-hazard questions, over to you, Margarita.
Thank you. Sorry. Thank you, Kea. While I'm trying to take my video start, okay. Yes, so the capacity, I guess it is important for us to understand that, like what we already saw in the poll, yeah, that nobody really feel confidence that they can have enough capacity. Yeah. We already experienced it with the pandemic, yeah, because within 100 years, this is the first time that we have a global pandemic. And yeah, to be honest, not even one country or even one organization is really equipped enough to deal with this. But the truth is, it is always be like that. Even like with natural disasters, even with the humanitarian issues, conflicts, etc., we never really know, or we never really can expect what will happen, because everything will be very contextual and that's where the world we're living in. We are living in the VUCA context, right? Volatile and yeah, ambiguous and etc. So for us, it's like we learn. I personally learn from my own organizations internally as a humanitarian organization or like as a CSO, civil society. We do need to uh, increase our agility, and this agility skills actually comes from experience. Although we never be too confident that we can manage the multi hazards, but the issue is the more you have experience, the more you have training, the more you have simulation, the more you learn from that one, and then equip yourself, your personnel, and your organization with the improved systems, the more actually confident level that you can help, and then the more capable you are to deal with the expected. So I think that's the most important thing, yeah, that we have to learn. I remember in my organization internally, when the pandemic started to be in the newspaper from the 31st December, even for me myself, I was like in the denial, saying that like, okay, the other SARS-CoV virus actually not really happening in Indonesia. So this one is still like four seasons virus. It might not happen in Indonesia. But the organization enforced me to to lead the preparedness of for this virus, and it really helped us. Yeah, although it's still like yeah, because it's a very new system that we tried to develop at that moment with very limited knowledge, but it helps us to understand, it helps us to, okay, what we do now, or yeah, what kind of things that we don't know that we need to learn, what kind of things that our current capacity can be utilized for this one. So internally, agility is needed. And even with the staffs or the partners, we talk about this. Some of the people who are used to the emergency response or disaster response, they are actually much more acceptance, yeah, or much more agile, much more resilience in the situation, because all the way of works are changing. We're changing, even until now. So yeah, that's internally. The systems also needs to be, we have to be, to embrace ourselves, to change our system, to improve our system. Digitalizations, information management system becomes very, very important. And then of course, again, although we try to internally equip ourselves, like Mayford said, we cannot do everything by ourselves. We need endorsement. We need updates information from other partners. We need to collaborate. We need to utilize our partnership. It is lucky that One of Us Indonesia is part of a member of the Humanitarian Forum Indonesia, where we have our WhatsApp group, we have our mailing list, that we can always communicate with each other what's going on, what happens, whether you already start the work from home. I remember we talked about it with some of our partners, like yeah, human initiative, like yeah, with local partners, like have you done the working from home? Oh, how do you work it out in your organization, or something like that? Yeah, because it is something very new to us. Partnership for information sharings, and also advocacy. Right now we have to realize, yeah, nobody is really equipped with the situation, especially we just think about one pandemic. We haven't thought about, we have to start thinking about hazards during pandemic. Right now Merapi is in the alert level. So, and then also flood season is coming up, and earthquake is still happening sometimes, and like in Philippine, typhoon is still happening. So uh, advocacy is really something that is important for us to prepare, yeah, because we need the government and also the donors understand it. So for me, advocacy, yes, it is for government, but also for the donor agency to understand our situation and what kind of things that we need to prepare, so we can work together to get the most effective or efficient way to deal with the disaster, to prepare for the disasters. And then also a lot of platform is actually happen in Indonesia. Yeah, for this one, we have the national cluster for displacement and protection. We have a national cluster for education, for health, and of course, this is some like the national cluster is under the Ministry of Social Affairs. So it's a good way to engage with the government for that one. And also a lot of NGOs in the, for instance, in the child focused organizations, we call it PKTA. They are actually endorsing like a lot of protocol for child protection during COVID-19. Also the gender based organization, they try to endorse like what is the gender protection for the protocol COVID-19. So those are the things that we really need to do, yeah, for preparedness, collaborate also for preparedness, because none of us can deal with this alone. And then also information management, again, this is very important. Digitalization is a new thing. It is not a new thing, but sometimes, you know, like as NGO, especially we work in a remote area most of the time, we said like, okay, that's all for the urban area, urban community. It cannot, it's still not happening in our rural side, but now we realize that even our rural side, if they want to cope with this situation, they also need to have access to all this information. They need to understand how to access it. They need to learn how to do that, and we have to be agile to do that. So information management system is important, and then all of this together, including the staff care and well-being. Yeah. So I think psychosocial support that Mayford is just saying, it is also important, because mental wise we are not prepared for this one. But with our experience, some of the people can uh, can be resilient more than the other, and then we have to help each other. Like some of us, like even from a week or 1 month after the working from home, is already is already being very frustrated and then very stressed out. We have to help them. But some of us who are used in the emergency response, our stress is like come very much later, but still there are stress that we need to help each other. So all of these things needs to be compiled in a disaster preparedness plan. And this is what I think sometimes in the normal situation we know that it is important, but we also have another obligation, etc. Sometimes it becomes like important but not urgent. And but I think it's still disaster risk reduction. Disaster preparedness is one of the most important thing for disaster risk reduction. I think back to you, Kala, for this one, Kia.
Thanks so much, Marguerite. And I think you really highlighted and emphasized that point about prioritizing preparedness and the need not only to be, like I said, agile as organizations, but when we think about capacity, think about it as leaning on each other, you know, as the collective. What is our collective capacity and resources we have that we can share? And I think this links to May 4th, when I'm going to get the term wrong, but said that culture of binan and, you know, leaning on each other and sharing across the sector as well. So thanks so much for that, Marguerite. And we'll have it, like I said, for the panelists. I'll move on to the next question, but then we'll have a chance as well to come back in the Q&A for this. Thank you. So moving again, you know, to Ipshita, we were talking that you're working in a different context, you know, where the predominant hazard there moment is the displacement and of Rohingya refugees living in the camps. And on top of that, we've got COVID and other environmental risk, and we've heard from everyone about the importance of coordination and collective action. I wonder if you could talk to us about, you know, the challenges you see in supporting coordination and collective action to empower local leadership and multi-stakeholder operations by CSO and NGOs, and then what the role is of networks can play in overcoming some of these challenges. Thanks, Ipshita. Over to you.
Thank you, Kia, and thank you, Mayforth and Margarita, for also identifying some of the key issues in a multi-hazard response, particularly in relation to COVID-19. As Kia mentioned, we are working in a slightly different context. We are in a district which is hosting the largest number of refugees in the world. Currently, there are 860,000 refugees, Rohingya refugees, who are hosted in a small district of Cox's Bazar in the southern coast of Bangladesh, in 34 camps. So we are in a difficult situation. So what I will try to do is just to give you an outline of what are some of the challenges that the district of Cox's Bazar is faced with while hosting a see what has been some of the impacts of COVID-19 in the last 7 to 8 months, and also in relation to the fact that Cox's Bazar as a coastal district is also affected by natural disasters like monsoons and floods, etc. As I mentioned, Cox's Bazar district has been receiving Rohingya refugees since the 70s, the largest influx being in 2017. At present, there are around 860,000, close to 9 million refugees who are, sorry, not 9 million, 900,000 refugees who are hosted in the camps in Cox's Bazar. The district of Cox's Bazar itself is considered to be one of the 20 districts in Bangladesh who are lagging behind, with a poverty rate of more than 30%, who are living below the poverty line. And also, as I mentioned earlier, as a coastal district, it is also amenable to natural disasters and environmental risks such as monsoons and cyclone, etc. With the arrival of refugees, certainly there has been a significant impact on the socio-economic and environmental conditions in Cox's Bazar. Uh, we have seen, so it has led to, particularly in the environmental context, it has led to deforestation. It has led to depleted water resources as well, and overall resources in the district, there is severe competition for limited resources. In the this has been particularly exacerbated during the COVID-19 context, where we saw the overall impact across the world, but also in Bangladesh, the socio-economic impact of COVID-19 has been significant. In the camps, with the presence of a large number of humanitarian actors, we were able to contain the spread of COVID-19. Currently, in the camps, COVID-19, there have been around 350 cases of COVID-19 which have been detected, and 10 deaths in the camps so far. However, the risk of COVID-19 has not gone away. But what happened due to COVID-19 was, due to the early interventions that were made by the humanitarian community, there was a significant reduction in the humanitarian presence in the camps. And the number of activities that were being implemented in the camp prior to COVID-19, and the significant improvements that were made in the camp since the influx in 2017, some of the activities were suspended when and only critical activities related to COVID-19 response were allowed. Now, assessing the impact of of this programming or limited programming over the last 7 to 8 months, we have seen a certain collateral socio-economic impacts that have been witnessed in the camps in terms of the protection situation of refugees. There have been increased the socio-economic situation of refugees has deteriorated in the last 7 to 8 months, with limited access to services, as well as income generation opportunities and education. Also, as has been witnessed in other parts of the world, gender-based violence, instances of gender-based violence has also increased. At the same time, we have also seen increase in social tensions between Rohingya refugees and the neighboring host communities. So it is not, it is a difficult time during COVID-19, where both refugee communities and host communities have been impacted. At this time, during the COVID-19 response, we also saw the monsoon season. Bangladesh had large-scale floods. The Rohingya camps were also affected. However, the kind of services that would normally be available in the camps during that time were not available because, as I said, certain activities were suspended. So the level at which, monsoon preparedness and response work could be carried out in the camps, they could not be during this year. So certainly there were more shelters which were damaged. The repair work could not be conducted in a timely manner. Shelter equipment could not be distributed in the camps at that time to the extent that it should have been in normal circumstances, as well as preparedness messaging was also limited. One other thing to note about the Rohingya camps is also that shelter programming or the provision of shelter equipment due to government regulations currently in place. No permanent structures can be constructed, only temporary structures can be, as a result of which the shelters require regular repair and regular refurbishment, which this year was not possible. So certainly we did see temporary relocations of refugees due to shelter damage in the monsoon season, more than as was seen in the last year, and the emergency response was not possible due to the restrictions I mentioned. We are also coming up into the cyclone season. In the last 3 years, we have been fortunate in the Cox's Bazar camps that the cyclones have not hit the camps. So there, but however, preparedness needs to be strong. Some of the issues that have come up in discussions running up to the cyclone season has been around limitations relating to access to affected communities, movement restrictions, uh, urgent mobilization of humanitarian support, as well as provision of immediate life-saving assistance, and also restrictions on communications in the camps. 3G and 4G networks in the camps have not been fully available to refugees and host communities in Cox's Bazar districts, particularly in the areas in and around the camps. Uh, and also currently there is also another development, which is that now the camps are also being fenced in, so that will also have some impact on humanitarian access in the coming days, including evacuation of populations during a natural disaster. These are all issues that are currently being considered. Keeping this broad sort of multi-hazard situation in mind, some key issues that from the coordination perspective that we have noticed are key challenges, but also something that we need to perhaps prioritize and look at. In terms of coordination, what has become very clear is that in terms of emergency preparedness, there has to be greater capacity and a mainstreaming of emergency preparedness into each of the sectors that are working in the broader humanitarian response. So intersectoral coordination in that sense is critical towards more effective emergency response, a multi-hazard response. What we have also seen is that there needs to be a broader preparedness and response and balanced programming, both for Rohingya refugees and host communities, because of the needs I just outlined of the entire district as a whole. So just focusing in the camps will not be, the humanitarian community and the development actors need to find a way to synergize efforts in that regard. What is also important is to build community capacity, both the capacity of volunteers through increased training, provision of equipment, and also to see how these community volunteers will be able to respond in isolation. Are they trained enough? Do they have enough capacity? And similarly, from the organizational side, what needs to be ensured is that are the staff equipped? Is there enough equipment to provide support, both in terms of flood safety gear, PPE, and other equipment that might be needed, and also along with emergency medical support? We have also seen that there needs to be an emphasis on staff safety and security. The staff also need to be able to understand to what extent they can respond, what are the limitations, so that preparations can be made accordingly, because we don't want also staff to be exposing themselves to further risks by responding in a situation where they are not fully aware of the situation at hand. What we have also seen, an area where we need to have more coordination perhaps, is both between the multiple layers of authorities that are responding to the crisis. So we have the district administration, we have the focal point for the camp-based Rohingya response from the side of the government, which is the office of the RRRC, the Refugee Relief Council, as well as the military. So within the authorities themselves, there is need for greater coordination. And then between the different levels of authorities and the humanitarian community, this sometimes needs strengthening. And sometimes there are communication gaps which might create problems, in addition to the capacity gaps which I have already outlined. Similarly, in relation to COVID-19, what we have seen over the last 6 to 8 months, particularly given the secondary impacts of COVID-19, that just responding to the health needs of Rohingya refugees is not enough. We need to have a gradual expansion of services in the camps, while keeping in mind the risks of COVID-19. But the secondary impacts are large enough for us to now consider gradually expanding humanitarian presence, because the increase in humanitarian presence and humanitarian services will not only create a sense of safety and stability in the camps, but it will also increase the trust between the humanitarian community and the refugees, as well as help reduce tensions between the refugees and the host communities, which can exacerbate, given if services are not allowed to operate in a normal way, or gradually expanded. Similarly, we need to acknowledge that there were pre-existing needs prior to COVID-19. The focus needs to go back to that, and we need to gradually, as I said, the gradual expansion of services will make sure that we address the broader needs, more holistically, the needs of the refugees and the host communities of Cox's Bazar. And lastly, the point that we need to focus on is on sustainability of the response, which means that more support should be provided to the local actors in the response. The first responders to the Rohingya crisis in 2019 were the local communities and the community-based organizations and local organizations. Uh, we need to continue to support them to
Just give
make
you 30
sure.
seconds. Thank you, Shida. Sorry,
Yes,
thanks.
and to make sure that they have access to funding, and they have their capacity is strengthened to be able to scale up their operation and continue to support, uh, as long as solutions are not found for the Rohingya, for them to be able to return to Myanmar. Thank you.
Thanks so much, Shida. Then you really highlighted the multiple challenges that are being faced in that context, and that compounding, even where there was preparedness programs, COVID has compounded the difficulty of implementing them and affecting access. And like Marguerite was saying, highlighting the mainstreaming of the core emergency preparedness along that coordination lines, and working it across all levels. So I think that will help stimulate as well our discussion as we move forward. Just before we get to our last speaker in question, we've got another poll question for you. So we're going to put that up now. And so, sorry, my screen. So the poll question that's coming up now. So the first one talked about your capacity maybe as individuals and organizations. And this one's looking at the environment that we're in. Do you feel like you have the support in the environment around us to be able to play a role in multi-hazard risks? another interesting. So again, despite all the challenges that we're facing, that there isn't enough overwhelming response here is that there's not enough support or not enough of a good enough environment to have the role we want to play in responding to multi-hazard risks. And I think, this takes us again nicely to our last speaker, Mihir Joshi, to talk. We've talked about the different roles of CSOs, communities, and the other actors play. But I guess the question is, who else should CSO and NGOs be working with to address and strengthen the role and resiliency of the humanitarian sector to deal with these hazards and vulnerabilities? So I hand it over to you, Mihir.
Yeah, thanks, Kia. Before I start, just wanted to know how much time do I have, so I will try to keep myself within that time.
I think we'll give it to around 5 to 7 minutes there.
Okay. Yeah. Yeah. So thanks, Kia. I think it's a interesting question because I think what we have seen because of COVID is that our general capability to respond to the situation has been kind of been limited due to various external factors, be it lockdown or the other issues. And what we have seen generally, even within the work which we are doing, is the areas where we had invested a lot within building the community mechanism for responding to any emergency situation has kind of fared better than the communities where there was no kind of intervention around that. And I'm talking about within the urban areas because, of course, within India, if you see, and that is true for other countries also, these pandemic has affected urban areas much more in comparison to rural areas. So I think that like the first thing is I think we have to really see that how we are kind of involving the communities who are at risk as part of our intervention. Because until unless we don't kind of hand them the tools and mechanism to respond to any eventualities, I think we will be providing more of a bandage kind of solution for any emergencies. So that's the first thing which I feel I think as a NGO and CSO we seriously need to see for any our program how we are empowering the intended communities so they can in turn respond to better, like they can respond to any eventualities within that area. And of course different disaster will have a different intensity, and there might be cases when that community will overwhelmed by that disaster, but then I think we need to see that what is that fabric or a network which we are providing. So at least we have a layered response approach for any community. So that's first thing. The second is also the our partnership. I think one thing which we have seen as part of the discussion is I think humanitarian sector needs to have a dialogue with other sectors. For an example, if we are seeing a IPCC report on the impact of 1.5 degree or 2 degrees, like what do that mean in terms of our response? Frankly speaking, we don't know. And I think it's time that we have more dialogue and we kind of simplify that scientific language into the language which can be understood by the community as we are working with the communities. So we need to have a good partnership with the academia and the research community where we share our experiences of working with the communities and current risk which is being faced by them, but also understand that what are the potential or future risks which communities might be facing. So we start including those aspects as part of our either the preparedness work or even I would say the response work which we are doing within the community. So that's a second intervention. Just to give you an example of our own work, we have partnered with Facebook and Google to see that how we can use the data of this either the Facebook from or Google, uh, which can be used as a algorithm, or as we call it, the artificial intelligence, to say that if there is a flooding, then what is the potential area where it can impact based on the data which is received from the communities who are living, let's say, near the river areas. Um, Same way, we have also tried to use the digital volunteers. I think now we have to go beyond the normal volunteer which we are used to think about within our sector. I think it's time that we try using the latest technologies, and which can kind of help in terms of the work which we are trying to do. So how we can make some sense out of various data. Like most of the countries now, the penetration of social media is quite high. So I think how we see this kind of tools which can use for our risk reduction work, or even the effective response work which we are doing. So that's I think the third point is that we need to find other avenues for partnership and try to see that how that can help us to build the overall resilience within the community. The fourth thing which we have seen, like any intervention by civil society will still be a drop in the ocean uh, if we are not having a good partnership with the government who can provide solution at scale. And I think over the time we have realized that whatever we do, I think our partnership with various government departments as well as various agencies is very critical, because if we have to sustain the good work, either be it on the risk reduction preparedness or response part, we have to kind of think of how we can institutionalize that work. And that's where the role of government is very crucial, because if you won't involve them, the civil society's intervention will still be a minor intervention compared to the larger communities who are facing such risk. So I think this is also very critical in terms of ensuring that we have enough kind of let's say pieces of jigsaw which can fix together and which can implement our like proposed solution at scale. And the final thing which I would like to kind of share is I think we most of the time we say that we know what are the risks communities are facing, but in our experiences, I think once you go and talk with communities, the perception of risk which you have and the perception of risk which communities have, that's a wide difference. And I think it's time that we also understand that how communities are perceiving this. Just to give you an example, like we work on a big school safety program within some of the Indian cities, and we are also kind of providing some solution related to infrastructure. And it's amazing to see that how a safe environment within the schools, like be it let's say less lightened area, or a kind of dark spots within the schools, or even having a kind of proper infrastructure for toilet, can increase the safety perception of those children who are coming to that school. So, so I think we need to really understand this risk perception, and then our strategy should be according to that risk perception rather than perception of what we have written as part of our proposal. So I think this is very crucial, because until unless we don't get to that level, we won't be able to change the behavior within those communities. So I think these are some of the kind of experience which we are feeling uh, like very confident that going forward, if we don't answer these questions, I think we won't be able to make a larger impact. So Kia, I will stop here, and I'm happy to kind of hear others on this. Yeah, thanks.
Thanks so much, Mihir. You did, I think, a great job of illuminating that jigsaw that you spoke about and the puzzles, government, private sector, other NGOs, and going back as well to the community. I think thank you for reminding us that the perception of risk we see is not necessarily the way the community may perceive it, and integrating that into our work. That concludes our discussion for now. I want to do a huge thank you to all the panelists for their presentations and stimulating and giving us thoughts for now for our discussion to go into. So we're going to open it up to questions now from the floor. So as Dee was mentioning earlier, you've got the Q&A function, and also you can raise your hands. So we do have a question. So I think there was one about the point that Mihir just wrote about engaging with government to scale up. And just to get the other panelists' perspective in your different country contexts of also working with government, the importance of working with government on scaling up response. So I'll open that all to panelists if you want to maybe turn your videos on and raise so we can, yeah.
Maybe I can start, Kia. So that is our experience actually in Indonesia, especially in the COVID-19 and also other previous experience. The importance to do advocacy to the government and to work with the government is actually because they have the macro level policies that and violence against children coalition in Indonesia. We also promote and then work together and discuss with the Ministry of Children or Child Protection and Gender Empowerment how to develop and we develop together the COVID-19 protocol for child protection. So with that, actually the guideline becomes the national level ownership, and then it has to be endorsed to the city. Is already there, so now we can support the local district leaders and community leaders to follow the guidance. So something like that. So that is, I think, the importance. And of course, doing the advocacy, doing the networking with the government, you need to really have a or build a relationship with the government. I think the stigma of CSO or non-government is like in the other side of the government. I think now, especially in Asia Pacific, I think it is not really necessary anymore, because we have to work together. We have to collaborate as multi-stakeholders. And not to mention that whatever we do with the government, it has to get the community feedback. So in Wahana Vision Indonesia, we have the citizen voice action, citizen voice and action, where all this government policy actually has to be confirmed with the community, and the community has to make practically make a scorecard and how far that the policy is endorsed and implemented in the community level. So us as a grassroots society, actually, this is our support to the government. So they know that their policy is implemented well in the community level. So we support the community how to make a scorecard, how to they discuss with the local government whether the policy is implemented right and contextualized to their needs. So those are the things that actually it's important. And I think it needs a skill of not being exclusive as a CSO, but also to work with the multi-stakeholders. I think that's from my side.
Thanks, May 4th. Did you what I can see?
Yes, I definitely I definitely agree with what she had said a while ago, that it is truly collaboration with the government is also a must, no. As I've shared a while ago, we had the feedback mechanism and was able to share it with the national government to improve their mechanisms. At the same time, also it is very important also not only in the policies, in making to make the response very very comprehensive and collaborative, also in planning is very important, that you do multi stakeholders and multi sectors in doing the planning for the response and other things, because right now the resources that you have, we should all share. The government should pitch in, the CSO should, and as well as the local communities. That's it. Just giving I just agree what she had said, with what she had said, sorry.
Yes. Thanks so much. Thanks so much, Rayforth. I agree with that. Are there any more questions that maybe while we're waiting, or if there are no hands, I will open it back maybe to panelists to see, like, from the different experiences and comments you heard from each other. Sorry, I keep forgetting. If you had any reaction to any of some of the points I think other panelists were raising about the solutions and priorities moving forward.
Yeah, hi, Kia. Can I just
Yeah,
come in?
go ahead, Mihir.
Yeah, I think the first point, and I think May 4th has covered the kind of almost all the issues. I think I think I have also covered partly in terms of what I was sharing. But I think it's time that we look at the communities with whom we are working as the strong partner in terms of the solution. uh, because and that's why I would say not the community based, but I would like to say community owned disaster risk reduction process, because I think if it's only community based, then till the time we have resources, it will be there. But I think if it's owned by the community, then we have a larger sustainability of the intervention we are trying to do. Of course, it's not going to be easy every time, but at least in terms of resilient communities, which we all are trying to work towards. So I think that is very critical. Yeah. Thanks.
Thanks, Mihir. May 4th, I can see.
Yeah, I agree with me here with that, owning the community. And just a short one with what Margetta was saying a while ago with capacity development. Increase our capacities in this new normal, more knowledge and skills in using technology, no matter how remote we are, we are forced to do that. Another is probably the capacity building for local leaders, like for example, yeah, community village leaders. Give priority in capacitating them, because if you cannot reach the whole population, at least the community leaders will be the one to go all the public awareness information, like for COVID and things like that. And at the same time, they can easily localize it, and can easily give feedback to the other actors that can give help. So capacity building for everyone, for CSOs and everything, but most especially for local village leaders. Thanks.
Thanks, May 4th. And I think, Margaret, did you want to?
Yes, I guess, yeah, talking about the capacity building, and also to echo Mihir about the collaboration, yeah. So one thing that usually the CSO is very attached to is like the community engagement, participations, and community feedback mechanism. So this is what we always feel like our core excellence. But we also learn from this pandemic and also other, yeah, like early warning systems for disasters, even it's flood, it's a volcanic, or even earthquake. We need like scientific evidence, we need like scientific approach, or we need like a digital technology that helps us. And I can say that not many of the CSO are going to that way. We are more on the excellence of our community participation. So I echoing with what Mihir said about working with the university, and I believe that there is one question there about how like Ohana PC can also collaborate with one of the like Sutomo University or Pak Prawida Direja. Thank you very much for your question. So I think that is important to also engage with the university or a research institute. I remember during the first pandemic eruption, uh, the globally all the research are open, especially for the COVID. They are like open and free access. So for us, like we are specifically working with the WASH, yeah, water and sanitation and hygienes. We can see from the all the research that have been published there, which is access openly, that we can see like, oh, what kind of sanitizers that is actually good enough for this response. So we understand that, and also what kind of behaviors that we have to endorse now to the community. We need this kind of scientific evidence, and also like the early warning system for the other multi-hazards. Yeah, I remember that in Indonesia, we learned from Jogja, Gajah Mada University, that there is a early warning system for landslide. And then there is also an early warning system for the flood that actually needs to be like scaling up. And of us as a who has a core excellence in the community participation, we can help the university to scale up their invention and study it, how the community can implement that, and at that also give feedback, yeah, to improve the invention, to improve the research, to be more applicable to the university or to the research. So I think that's also one part that we need to improve ourselves, because yeah, more of like social CSO are more on the social level, but then we need also science to improve the preparedness. That's from my side. Yeah.
Thanks so much, Marguerite. And this idea of, again, reiterating the sorry, hi, I think I'm back. Yeah, thanks all for highlighting about the innovative solutions and community owned as well, not just community based responses in the capacity building models as well, and looking at our different approaches. We have one more question. I'm wondering if the panelists may be able to encourage to answer as well in the chat box, just because it's multi-part, and just looking at the time here. Looking at how this is linking with the other preparedness work that you're doing in relation to other hazards, not linking the COVID work and the other hazards that you're facing, and how some of that links, and some of the smaller scale hazards as well, and the preparedness around that. So that's in the Q&A, and would encourage panelists there if they want to respond in more detail. But if anyone has any short comments they'd like to add to that now, please feel free to do.
Hi, Kaya. I can kind of try to answer that, because we have responded to two hazards with COVID within India. One was the cyclone in the eastern part of India, and the other was in flooding. So I think one is that we have to really look towards the standards which we are following. We can't follow the same standards which we follow in a normal emergencies without COVID, because what those standards are saying to us is completely different than what is the proposed solution for COVID when it comes to either the social distancing. So I think we need to look at those kind of standards to prepare ourselves. The second is what is our own mechanism to respond for those disasters. I think, as I've said, the COVID has really showed the importance of having a good mechanism within that community who can take the leadership after any emergency. And I think that's what we are trying to kind of capitalize on, that how we can empower, let's say, the local volunteers within this area so they can take this work forward in terms of the immediate response as well as the long-term recovery. So I think we need to really identify such. It can be also small organization at that level, but we need to really identify such players and then try to build strategies to capacitate them with the proper know-how so they can take that work forward. So that is something which we are also trying to do. In terms of the other smaller disaster at the organization level, we are preparing some kind of let's say SOPs that okay, if you are responding within for flood with COVID, then what are the precautions which you should take. So that is of course internally we are kind of sharing with our staff who are responding on this situation. So I think we also need to think of such mechanism, and we are also trying to work with some of the local governments to that's how we can build the immediate capabilities of the health infrastructure, because if they require a larger space for quarantine, then what can be the cost effective solutions at that level using the local knowledge, local material, and those kind of stuff. So these are some of the kind of strategies which we are trying to adopt to respond to various emergencies. Yeah, thanks.
Thanks so much, Mihir. And thanks to, again, all the panelists for your really thought-provoking discussions and really concrete solutions and strategies for all of us to think about as we move forward. With that, I'm going to hand over back to Ridzki for the closing. Over to you. Thanks.
Thank you, Kia, for the very informative discussion. So I would like to remind all the participants, if you missed the Q&A section, you may check the Q&A button and see a list of questions with the answers by the panelists. So before we end this meeting, we would like to invite HFI, ADRRN, and ICFA as an umbrella organization to share with us some recommendation on how we can collectively address risks posed by multiple hazards as closing statement in this webinar. We will invite the representative of HFI, Surya Rahman. From ADRRN will be represented by Takeshi Komino, and from ICFA we will be represented by Kia Shaha Chowdhury. So we will start from Pak Surya first. Pak Surya Rahman, you may have the floor.
Okay, thank you, Rizky, for this opportunity. The first of all, Honorable Kia Chaudhry, Regional Representative of ICFA from the Asia and the Pacific, Takeshi Komino, Secretary General of ADRRN, and then Thomas Indrajati, President of Human Initiative, and all panelists and all participants here in the Zoom webinar. Good afternoon from Yogyakarta. I hope everybody here feels safe and healthy. We have discussed some of the important points on how we can better support the communities to play their role in the multi-hazard mitigation and prevention program. Capacity that we need, particularly during this COVID-19 situation, some challenges faced by us, and also kind of support that we need. From us, SFI as an umbrella organization, we realize that the process of the handling multi-hazard impact and the spread of the COVID-19 cannot be done by individually, but through collaboration and synergy and learning together both across NGOs and through network, it can can be an alternative and inspiring for the dealing with the global problem that we face together. It's important that to have a systematic coordination with the shared value that we are doing this only for the humanitarian agenda. Having systematic coordination can also be translated as a proper understanding and skill on the community that we are serving, understanding the risk, and enough support to face the impact of the multi-hazard, including COVID-19 pandemic, that we can mobilize collectively. Collaboration, synergy, and learning from each other are also important, so that we know that of the experience and the gap that we have, and we can better improve ourselves. I also would like to highlight the importance of the empowering and supporting a local initiative to create intervention and innovation in mitigation and preparedness and the response, either is structurally or not structurally as effort in developing resilience and a part of the localization. We may not be with the community the whole time, and at the end of the day, it's the community themselves who will need to handle the impact of the multi-risk in their own area. Lastly, on behalf of all organizers of with this webinar, Humanitarian Forum Indonesia, together with ICPA, ADRRN, and Human Initiative, would like to thank to all panelists, participants, and other parties who have a support of the series this event for the first webinar until this 5 webinars. Thank you. Back to you, Rizky.
Thank you, Pak Surya. So for the second closing statement will be Takeshi. Takeshi, you may deliver your answers and closing statement. Thank you.
Thank you very much. On behalf of ADRN, we would really like to thank all the panelists and also the participants for this fantastic sharing of the knowledge and experience. I think we take some of the key messages from this webinar. And this is quite important because this event is also part of the 2020 Regional Humanitarian Partnership events, which also would have a significance to the new strategy, post-2020 strategy of ADRN as well. And for that, I take a few key points from this webinar as well. For example, we talk a lot about multiple risks, but do we really understand the magnitude and the interlinkage and intersection of these risks? And we talk about early action also, but where and when to start such early action? I think we need to dig deeper into how we can learn from community perspectives as well. I also take the message that there needs to be further linking of science and community. I think we need to strengthen the partnership and be a platform where such cross-fertilization between the sector can also happen. I think, we have this tagline, we say, make the decade count. 2030 is coming just around the corner. We're in ending of the 2020. 10 years of journey in this disaster management has begun. And as for representing ADRN, I would also like to reaffirm our commitment to make this region a safer place, and for ADRN to become that platform where such exchange, learning, and professionalization can happen. So thank you very much to all of you for such fruitful discussion. Appreciate it. Over to you.
Thank you, Takeshi. So for the last closing statement, we'll be back to Kea. This is the third time for me to introduce Kea. So Kea,
I'll keep it
yours.
short. People can be sick of my voice. But again, just a huge thank you. Like this about collaboration. I mean, this is a testament to the collaborative effort that to help make this webinar happen. And I think the message, like Takeshi, that I really take away is about collective action is working not just across sectors and like we've heard with NGOs, civil society, communities, government, academia, technology and private sector, and at different levels, but is also using our different platforms to be able to support community resilience and be able to deal with multi-hazard and multi-sector responses. So bringing together those linkages, I think, is a key message, and being innovative in the different ways that we can do that, and understanding our collective capacity and assets, and as a platform, helping use the platform that ICFA has and the connections in helping facilitate this sharing, and also these there was talk before about advocacy and connecting at policy levels and feeding into that discussion from local to regional and global levels as well. So that's it from me. Thank you.
Thank you, Kia. So before we end this meeting, I would like to thank all the panelists. Thank you, Mayford, Ipshita, Margareta, and Mihir, and also the moderator, Kia. And we would like to also thank all the participants, both on Zoom and all the streaming platform like YouTube and Facebook. Your contribution into the discussion is much appreciated. Thank you for Mbak Mada, the sign interpreter. And thank you all. So we will see you in the future webinar. Stay safe and have a good rest of the day or night. Thank you, everyone.
Thanks, everyone.
Thanks, everyone.